Hello, Dr. James Bogash, expert in health and longevity and practicing chiropractor who sees headache and migraine patients quite frequently. I'm also the author of the book Migraines and Epilepsy, How to Find Relief, Live Well, and Protect Your Brain. So this particular article really hits home, and it's something that I interact with on a pretty regular basis. All of the evidence points to migraine problems being a problem with the blood vessels. This isn't our old, they expand or they constrict and then expand, and that's what the triptans were designed for. That's not what we're talking about here. We're talking about unhealthy blood vessels leading to poor nutrition to the brain and migraines that happen as a result of that. A lot of miscommunication about what a real migraine is. I have patients coming in all the time. They're like, oh yeah, I have my migraines and they're back here. And those are generally not migraines. Those are, I call them structural headaches. And they're different than migraines. Migraines by definition occur on one half of the head at a time. It doesn't mean that they can't switch sides, but there's a lot of misunderstanding about what a true migraine is. But just rest assured that a large body of evidence is pointing to the fact that migraines are a blood vessel disorder. If we make the blood vessels healthier, we will help the brain and help with the headaches. It's never the approach with mainstream medicine. We always want to look at the newest drug, the shiniest drug, and the latest one to hit the market is the anti-CGRP, the calcitonin gene-related peptide. And when it came out, people were like, oh my gosh, this is the answer, this is the problem with migraines, and it's still not. And this particular article really points to that it's absolutely not addressing the underlying problem. We think of those like Aimovig, Ajovi, there's like four I believe that are for rescue, or 2 for rescue and 4 preventative. Once Aimovig hit the market, the other ones kind of fell in line after that. But this was an article looking at blood pressure elevation in people on these medications. And they found that it was definitely a class effect. The people on these these migraine drugs, we need to check their blood pressure because it's not unusual for it to go up during treatment. So it wasn't a lot. It was systolic hypertension, or systolic blood pressure went up by about 5.2. Diastolic went up by about 3.5. But again, if blood vessels are the true problem with migraines, anything that's really fixing the problem should drop blood pressure, not raise it. So that really makes me think that these class of drugs are not really fixing the problem at all, and may even be making it worse, and B, we're not going to see any changes in long-term trajectory of things like heart disease, stroke, or cognitive decline in migraine sufferers, because we're not really fixing the problem. We've just found the newest hole to put our finger in the dike of. And the reality is these people really need to address lifestyle that's going to keep their blood vessels healthy. That's really the only answer to migraines. As always, I'll post a link to this particular study in the description. Make sure you like this video, share it with somebody who you think needs the information, and subscribe to the channel.